Space, let's talk about Insight Edge. Today we focus on Medplus Health Services. The company has received several orders for drug license suspensions across states. We did speak with the management. Ekta joins in to tell us what exactly, was the edge that we took away from the insight that the management gave us.
Well, on this specific thing about, these suspension orders that they've got for 3 days or 4 days, they said that they are implementing better control and IT systems in stores to ensure better compliance. Now, separately, something very interesting, they have started selling generic drugs in a couple of their stores, and that basically is a 50 to 80% discount to what is available to the drugs which are branded, only because they don't have marketing costs that they incur. So they have indicated that 18% of all medicine stores in the Telangana region are of the Medplus brand as of now. They expect the industry to change due to the introduction of generic drugs. So people will soon, understand that these drugs are even cheaper than the branded drugs which are available, because while the quality remains the same, the only reason that they're cheaper is that they don't have all of the marketing costs, which are the overheads involved. Now, they reiterate that the store growth projections for FY24 still stay the same. So they're looking to add around 800 stores in FY24. They expect FY24 revenue as well as margins to be better. Remember, margins have been a concern for the company. They don't expect P's to sell down completely, which is interesting. Premji Invest and Warburg Invest may look to pare down stake during the course of the year. They could sell a little through the year. They don't expect an entire exit. They have taken an enabling resolution to raise, I think, around 1,200 crores in terms of funds. They won't raise funds until there is a plan to, say, probably expand in the diagnostic space. So as of now, they have enough funds on their books to, fuel their own growth plans. But if they want to expand into diagnostics, that's probably when they'll probably look to raise funds. In any way, we did speak to the management earlier in the morning. Let's listen in to what they had to say.
We were at around 2.42 crores per day in Telangana when we started it. By the end of September, we basically reached 2.83 crores. So massive uptick, I would say. We have products available for roughly around 55% of all the medicinal needs. And we have seen an uptick of almost a third of that. So 18% of all medicines today sold in Telangana region are from the Medplus brand. I think they're still going to be in line with what we had actually earlier said. I don't think there's going to be any major difference out there over last year. We think now, for the first time, with the way the Prime Minister's Jan Aushadhi program is going, and the overall awareness being created around the generic products and all, and the fact that Medplus is now has the scale to actually buy and basically get the drugs made and sell them in our own stores, and thereby disintermediating some of the companies out there. I think the industry itself is going to change significantly. I think that's going to be the story this year. Mainly because a lot of our stuff is now private label, and so the margins are going to be slightly better. It is not as the current set of private label which we have is obviously not as profitable because we're giving 40 to 60% discount out there on all these drugs. But overall, since these are actually displacing the branded generics on which we make far less, we would actually make slightly better margins as we go forward. I see no reason to, really believe that they want to, at least my conversations with them have not led to any conclusion on that part. But as a private equity company, they will want to get out of the public market sooner or later. They also hold a significant chunk right now, along with Premji Invest. So between both, they hold roughly around 20%. So I see that they will take every opportunity to sell down a little bit. I don't think they're going to be selling down everything in one shot for sure.
All right, that's the management of Medplus. Meanwhile, just take a short break, come back on the other side. We talk about Zomato.